I'd like to welcome you back to the channel. So we have with us today Dr. Emil Chynn, who is a world-renowned eye doctor. Hi, doctor. How
Hello.
are you?
Good.
And so the reason why I asked you to come on is because I'm always interested when it comes to people that are involved in parts of people's lives where they make a big difference. And, you know, you have this whole story about LASIK to LASEK. And if you could share a little bit with my audience of your story, I understand it involves yourself.
Yeah, it's an interesting story because I started going into laser vision correction. In ophthalmology, you get to choose different specialties, subspecialties. My uncle was a retina surgeon, and I'm actually a third generation eye surgeon because my grandfather was an ophthalmologist too. So I decided to go into refractive surgery because I always had a very high prescription and always dreaming about not wearing glasses or contacts. And then this is really for 20 years or something. So, hey, Dr. Emmer, can you just close the door? So, so basically, it started out with RK, which is these little incisions in your eye that was started out in Russia, the little thing there. And then that was like in the 1980s. And then in the 1990s, the laser got invented at Columbia when I was there. So I went to Columbia Medical School from 88 to 92. And then Francis Lesperance and Stephen Turkel were the two ophthalmologists who invented the excimer laser, which is used in every country in the world for laser vision correction. So, you know, I was kind of interested because I was at the same institution. And then when I was at Harvard for my residency, I decided to do my laser vision correction in like 1996, I think that was. And at that point, I was the first eye doctor in New York State to get LASIK. And I did my left eye first because that was my non-dominant eye. Everybody has a dominant and non-dominant eye. So it's almost like right-handed, left-handed. The dominant eye is the one you shoot guns with or take a picture with the camera or play pool. So because this was really early in laser vision correction, it's almost 30 years ago, I decided at that point, a lot of people are doing one eye at a time because they weren't sure exactly how well it was going to go. The technology wasn't that mature. So I did this one. And then my day vision came out fine, but then I had a lot of night glare and dry eyes. So basically, at that point, I'd done about 5,000 procedures myself. It was probably about like 1,000 PRKs and 4,000 LASIKs. Okay. So it's because when you cut the flap, you're cutting the corneal nerves, and that causes some dryness because our blink rate is normally about every 5 to 10 seconds. There's no clock in your brain that's telling you to blink. It's the subconscious sensation of dryness. Okay. So when you cut the LASIK flap, you're cutting about 80% of the corneal nerves, and they don't grow back. Nerves really don't grow back. That's why if you're paralyzed, unfortunately. So if you think about it, if you do LASIK or you have it done to yourself and 80% of your corneal nerves are dead, you're going to be relatively anesthetic. In other words, your cornea is not going to sense the dryness sensation. Okay. So it's essentially, we've done studies after LASIK, and the patient's blink rate is every like 10 or 15 seconds. It's like half as frequent just because your eye is not sensing dryness and sending the signal to your brain that's causing you to blink. Okay. So when I was doing LASIK, I was also guilty of saying, like many LASIK surgeons to the dry eye patients, try to blink more. Okay. It's kind of stupid. You can't just consciously blink your entire life millions of times. It's just dumb. Okay. But I'm just saying, I'm admitting that I was saying that too, because, you know, that's the problem. Why don't they just blink more? Okay. So, and then the dry eye thing, that's what it's from. The night glare thing is when you cut the flap or put the flap back, your cornea for the rest of your life is two pieces. It's so much two pieces that the way to enhance a LASIK is just pop the flap up with a little thing, looks like a toothpick, and then you laser it, you put it back. Okay. The only thing that's holding the flap down is like a little tiny piece of skin. It's nothing. That's why, unfortunately, after a LASIK, it could be 10 years later, get poked in the eye. If the fingernail just hits that little edge, you can rip off the flap, and sometimes it gets ripped off and lost, and you just won't see well for the rest of your life. Okay. People don't know this about LASIK. So it doesn't happen often, but I'm just saying your cornea is always going to be two pieces. Okay. So how does that help with the glare thing? When your cornea is two pieces and the light comes through, it's going to have some scatter, like reflection or refraction off of the interface. In other words, if you had a pair of eyeglasses and you wanted to adjust the prescription because you went to lens crafters, it wasn't perfect. And you give it back to them, you hear them start grinding it and polishing, they give it back to you. They're not cutting it in half, polishing one half, and then gluing the thing back and say, here you go. Because if they did that and you put it on, you're like, I guess I'm seeing better, but there's some glare and stuff like that because you got a two-piece eyeglass. You would never do that, okay? But I'm just saying in LASIK, your cornea is always going to be two pieces for the rest of your life. And that's why the majority of LASIK patients have a little bit of dryness because you can't help cutting the nerves and a little bit of night glare. Now, the problem is, as surgeons, we can't predict who's going to have a little and a lot. If we could, it'd be great because we do the quicker LASIK procedure, 1 or 2 day recovery on the majority of patients who are not going to have these problems. And then the minority of patients who would have the problems, then you go to the LASIK, which is a longer recovery. Okay, so at least you don't force everyone to have a longer recovery just because you want to prevent the night glare and the dry eyes, because you would only do it on the patients that were going to get that. We can't predict. To do millions of different tests, we can't do it. Okay, so that's why I didn't even do this eye. I stopped at my non-dominant eye. Okay, so then at that point I switched my practice to non-cutting, and then I waited like 10 years until this thing was really refined. And then I became the first doctor in the world to laser their own eye. So this is like 3 years.
Oh,
ago.
really?
Yeah, an entire world. So 3
How
years.
can you do that? Did you endure pain or?
Well, because there's epi-LASIK, instead of cutting a flap, there's a little epikeratome that's got a plastic separator that's not sharp enough to go into the cornea, and it just skids across the surface and it takes off the skin of the eye, and then you just laser. So normally I'm doing that with a foot pedal, but I had a foot pedal on my chest, I think. So I did it with my hand, and then the laser does track, by the way. Okay, so yeah, it was fun. It came out 2020, by the way. And then I think we would have gotten more PR about it, but we did during COVID and it was like all closed down. But anyway, I'm still the only, as far as I know, I'm still the only surgeon in the world that lasered his own eye because I wanted to show the world the non-cutting thing is safer. And then I don't have any dry eyes and night glare, but it did take twice as long. Okay, so this eye was good in 1 or 2 days, and this eye was good in 3, 4, 5 days. It's twice as long. But as long as the person's willing to have double the recovery in days and kill a weekend, I really think everybody should do this procedure because it's safer. You don't have the dry eyes, you don't have the night glare, and for the rest of your life, you get punched in the eye. It's fine. There's no flap. I lasered Missy, who was my secretary like 10 years ago, and she lives in the Bronx, and she got mugged. Somebody punched her in brass knuckles, okay, right in the eye, okay. And I said, Missy, why did you get punched? Why didn't you go? I said, because I'm like from Manhattan. I'm like, why didn't you just give the mugger your money and they wouldn't have punched you in the eye? And she's like, no.
We're not like that in the boroughs.
She says in the Bronx, they hit you first. And I say, why did they hit you first? She's like, because if they threaten you first, too many people are carrying weapons, like guns they're packing. And then the guy would take out the gun and say, you want to rob me? I'm going to pop you. You know, so they hit you first. So anyway, but she just had a black and blue eye. She didn't lose any vision at all. And if she had done the cutting LASIK procedure, she would have been screwed. So it is safer for the rest of your life. You do have a less chance of night glare and dry eyes, but you have to have a longer recovery. That's the difference between the LASIK and the LASIK and how I got there.
Interesting. And with the LASIK, once it's done, it's too late. You can't go back to your other eye.
Well, you can enhance, okay, you can enhance a LASIK with surface ablation. And I wrote an article about this about 10, 15 years ago. So again, traditional way to enhance a LASIK is you pop the flap up, you laser, you put the flap down. There are a lot of problems with doing this up and down thing again. Now the best cornea surgeons in the country, like top 10%, they're just lasering the surface, which is essentially a LASIK on top of a LASIK. They're just lasering the flap. So if anyone out there has a LASIK and wants to get enhanced, they really should ask the surgeon, are you going to lift up the flap or are you going to laser the flap? If they say they're going to lift the flap, I would just go to someone else who's more experienced, like a cornea specialist like myself, and they would just laser the flap. It's a lot safer than digging up the flap. So
interesting. Now, it sounds like you have this theme of being transparent. You did your own surgery, and also you're known for having this big open window where your surgeries are
yeah,
done.
we have the only all-glass window in the United States, and it's really just to tell it's the same reason that I lasered myself. It's really just to show the customer that the non-cutting thing is so safe, because we can't have a cutting complication in the operating room, that everybody can watch every procedure. It's almost like open kitchen, right? So if you go to a really high-end restaurant, like I was just in Paris with my ex-girlfriend a month ago, and we went to a Michelin restaurant, it was like $1,000. and you can watch your meal being prepared, but that's because it's perfect. They don't have any
Right.
dirty stuff around. They don't have any cockroaches or mice. So I'm just
Right.
saying the open OR is like open kitchen. It's like we're so safe. Every procedure could be watched. And last week I just decided we're going to stream every case. So now the patient's consent is going to get streamed, and every case we're streaming because it just shows we're so confident that we're not cutting flaps. We can't have a problem. Every case is going to be live streamed.
So it's the opposite of like when they take your loved one into an operating room and you can't go past a certain point. Over here, you're like, we have nothing to hide. You can
It's
watch.
really opposite because when I did this procedure at Harvard, because I was working at Harvard as an eye surgeon at the time, they let me bring my girlfriend in to kind of hold my hand. Okay. So even though I was familiar with the procedure and I'd done a few thousand of them, just having Mary there holding my hand and familiar voice, it was really calming. So I said, hey, when I open my own center, I'm gonna allow that. And now instead of just allowing it, I'm mandating it. So everybody getting lasered at Park Avenue LASIK has to bring their wife or their mother or their best friend. And it kind of really helps the experience because it's just a lot easier if they have a friendly voice there. And also, we're the only center that has laughing gas. We're the only center that has nitrous oxide. We're the only center that has ketamine if you're really nervous. And by the time you give all these medications to the patients so they can't be nervous, they get a little forgetful. So that way the companion, or we call it coach, can remember all the directions and the pressure's not all on the patient. They can just relax. And it's been life-saving as the surgeon because there's some patients that couldn't laser because they freak out under the laser, but because they have their wife there, she just settles the guy down. Oh, honey, it'll be fine. Don't worry. Just think about us going to Bali next month. And
Right, right.
so again, I think we're the only center in the United States that mandates that you have a loved one in the operating room with you.
Wow, that's funny. Interesting. So I guess that means that the surgery is done while they're awake. Is there a reason for that? It can't be done while they're
Yeah,
sleeping?
there's a very good reason. Like about 20, 30 years ago, okay, we tried doing something where the surgeon was fixating the eye with like a device, and then I would aim the laser at the center of the eye, like the middle of your pupil, right?
Okay.
And then it didn't work out very well because the very anatomic center of your eye is where the optic nerve is going back into your brain. There's no photoreceptors there, so it's actually a blind spot, okay? So the visual center of your eye is not the same as the anatomic center. There's something called angle kappa. So if any of your viewers are super geeky, they can Google angle kappa, but it really just means that the anatomic center of the eyeball is not the visual center. So that's why now we have to make the patient stare at a blinking LED so their optical center is centered. We don't want their anatomic center centered.
Wow, that is amazing. So you got to be awake because you have to focus on something to keep. Oh, wow.
Yeah.
Okay. So a couple of just simple questions. First of all, how long does a procedure take, assuming there's no complications? Standard.
It takes about 10 seconds per diopter. So if you're -5, it would take 50 seconds. Okay, that's for myopia. And then it's very quick, by the way. And if you're farsighted, it's about 20 seconds per diopter, because farsighted, I have to do this little donut that takes longer than just doing the center. So let's say you're +2, then it would take about 40 seconds. So when I had my eye done, this is again 25 years ago, the laser was shooting. Every time the laser shoots, it takes off a little bit of prescription, a little bit of tissue. So it was like back, 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 like that. Okay. Now the laser keeps getting these software, hardware upgrades. It's like, it's like a machine gun. So it just gets the pulses.
Right.
So.
Wow. So they're in and out in moments.
We've had lower prescriptions, like -1 or -150. It's like 10 seconds. We've had patients say, okay, I'm ready. And I'm like, yeah, we're done. They're like, you're one? You're like, yeah, we're done.
Wow. Yeah. I see you have that the jar collection of glasses for people on their way out. It's pretty funny. My next question is this an expensive thing to take upon
It's
oneself?
not really expensive. Okay. So what I'm trying to train my staff. Like obviously when patients call, a lot of their barriers, like, I don't know if I can afford it. Okay. It really depends on how you kind of phrase it. Okay. So what I like to do is say that as long as you're in contacts, we know that you can afford it. And they're like, how would you know that? Because you don't know my budget, right? I'm like, this is how I know. What we do is we calculate how much you're spending on glasses or contacts. Okay, so if you're in a daily disposable contact, it's $1 a day. It's each lens is $1. It's $2 a day. 365, you're up to like $750. Then you have to get the glasses, the solutions. You're kind of up to $1,000. Okay, so you're spending, whether you like it or not, and you don't know it, you're spending $1,000 a year. Okay, so the laser costs $4,000 for 2 eyes for standard definition. You see like glass or contacts. $5,000 for 2 eyes, high definition. You can see sharper than glass or contacts. Okay, so if you think about it, you could take a loan for $4,000 for 2 eyes and just
Right.
pay off $1,000 a
Pay it
year.
back from that money you would have been spending.
It's the same amount of money. It's like
Right,
you're
right.
like free.
But that's not an enormous amount. That's not like 50,000. That's
No.
something that somebody's tight, but they can
Everybody
borrow
can
a couple of
afford it.
grand.
Everybody can afford it. All you have to do is not spend on your glasses and contacts. Now, that's if you're in contacts, okay? Because contacts are pretty expensive. If you're just in glasses, I can't say you can afford it, but I'm just saying anyone in contacts, they just take that money and put it towards the laser and financing instead of their contacts, and it's free.
Gotcha. Now I got one more question, which is personal, and then I'll let you go because I know you're a busy man. So here's the thing, right? I have one eye where I see further clearer, and then I have one eye where I see closer clearer. And
Yeah, you have one far-sighted eye, one nearsighted eye. It's like monovision.
monovision, that's what the doctor said, but this only happened later in life. I think that for the most part, it was just one eye that was weak when it came to the far sighted.
Does your right eye sometimes go out when you're drunk or tired?
Yes.
Yeah, because I could see that it's probably a little bit deviated. You know, the average person can't see, but I could see because I've seen 100,000.
Yes.
Yeah.
Why?
So
Why? What's the reason for that?
you got a slightly lazy right eye, I think. In other words, your left eye is probably like normal. Your right eye might have a different prescription and it's maybe a little bit lazy, but we're the only center in the country that's fixing lazy eyes, by the way. So we published a couple studies about that. So the reason we can fix lazy eyes is a lot of people just give up on the eye because it's like a bad prescription. It's a little bit lazy and sometimes it wanders. But if you think about it, this is called refractive amblyopia. The brain is ignoring the eye with the worst signal because it's not a great signal. Okay, so let's pretend my left eye is 20/20, not a bad prescription. My right eye is not 20/20, it's got a prescription. If I don't correct it at a very early age, my brain's just going to ignore this eye. And because there's 6 little muscles per eye aligning it, it's going to go a little off. The only thing, 90% of people have a little deviation in the eyes. If you cover the eye, you'll see. The only way it's straight is the brain is keeping the 2 images aligned. And if this eye wanders, the image starts going at that. It's called like a skew deviation. And the brain's like, oh, wait a minute, I'm seeing double. And it kind of puts the eyes back together by putting the muscle in. So only 10%.
It's not necessarily bad eyesight. It could just be.
No, that's normal people. Only 10% of normal looking people with straight eyes have eyes that are aligned without that thing. 90% are straight because the brain's putting them together. Okay. But if you think about it, if this eye doesn't see well, it's got a blurry image and it deviates. Why the hell would the brain put it back? Because it's a blurry image anyway. It's going to ignore that image. It's just going to look at this image, and this will just go off. That's refractive amblyopia. Okay?
So, what I was leading up to was that recently, over the last year or two, I've noticed that there's a certain distance where there's a sweet spot where I'm screwed because my local, the short-sighted sees fuzziness and the far-sighted sees fuzziness, and it's about the distance. I thought it was from like being on the computer too much, but then I realized it was the distance of exactly where a computer sits.
Yeah, no. So you could change that if you wanted to. In other words, I could put any prescription on any eye. Okay, so let's pretend that unfortunately that's like the distance you need. Okay, so I could take an eye, let's say one of your eyes is now focused at 14 inches. 14 inches is more like reading a book or something, okay? And then a laptop is more like 20 inches. And then a desktop's more like 24, 22 inches because you got the keyboard. So I could take that eye and just adjust the focal length of it. So instead of you seeing great at 14 inches, if you wanted to, I can make you see great at 20 inches so the computer's fine. So, and you can test it out with a contact. So I would just contact one of your local optometrists. I tell them what contacts to put in. And then
But this is not something that LASIK would help with.
No, I'm telling you, I would, if you really were interested in this, what we would do is I'd contact your local optometrist, tell them what contacts to put in as a trial. And once you got to a vision where the distance was great and the vision was great, then I could just put that onto your eyeball with the laser. So the contact lens trial is just to get the thing right, and then we know what to enter into the laser.
That's fascinating. Well, thank you. My last question, I apologize, just one more. Is it a myth that if you wear eye patch or one of these, pinned glasses, that it strengthens your eyes?
Well, okay, when you're a child, if the school physical picks up that you have a lazy eye, standard treatment is you patch the good eye to force your brain to look and attend to this eye. So that's why you're patching as a child. Recently, we found that you can actually patch adults and they can see better. It's because the brains have more elasticity, it's called, than we thought, or plasticity. So it really just means that we see this all the time in the lazy eye patients. Okay, so just like a week ago with this kid who had one good eye, one lazy eye. This lazy eye, the best vision that they could have in glass or contacts was 2100 or something. And we just lasered the guy. And then right afterwards, like the next day or something, he was 2060 with no correction. So he was seeing better without anything than the best vision they could get with the glasses or contacts. And then I told him to start patching the good eye. And then after like a month of that, he got down to 2050, which is legal to drive in the daytime. It's amazing because before this, his lazy eye could just see 2100 with glasses, and now he can see 2050 without glasses. So anyone there who's got a lazy eye, you really should come for the evaluation, because I'm not going to laser you. I'm not going to help you. It's not like I care about the money. I'm retiring actually. So, but if anyone thinks that they can't get the lazy eye fixed, we buddy people up. So we actually let you talk to somebody else who had a lazy eye, and then just get it directly from the horse's mouth. So
Interesting. So you believe patches do work for adults also?
not
In
as well,
certain cases?
not as well as for children, but they do work. They just don't work as well because your brain is not as elastic, right? Just like you could learn foreign languages earlier, easier when you're a child. It doesn't mean you can't learn as an adult. It just takes more work.
Interesting. I gotta ask you, I know I keep saying it's the last question. You were on a whole bunch of shows. Um, which ones can you think of off the top of your head?
Like
You
I was
said
on
how
every major network, ABC, NBC, vs Fox, even though I'm not exactly a Trump guy. And then I was also on New York Times, Wall Street Journal, and also on Millionaire Matchmaker, Bravo. I was on Howard Stern about my dating life. I've been on like a lot of stuff. I was on CNN Live about my dating life. So I was like, yeah, crazy.
That's awesome. Thank you so much for coming on. I really appreciate it.
Oh, it's been a pleasure. And again, if you want a consultation, you could do it remotely. And we're the only center that takes medical insurance, by the way. So if you're good medical insurance with a low deductible, we're not talking about Medicaid, we're not talking about vision insurance, just like whatever Blue Cross Blue Shield, it'll cover the cost of the consultation. And we could get maybe up to 50% of the laser covered by your insurance. So that's just something that we can do with affordability. So
Awesome. Thank you so much.
thanks a
I will,
lot.
I will put your information in the description, by the
Yeah,
way.
yeah, people could always
They have it.
chat. They could always contact me on Instagram. It's like Park Avenue LASIK. They get and live stream. We're gonna live stream every Thursday. So if they go to Park Avenue LASIK on Instagram, they could type in their questions during the live stream.
All right. Take care, Doc.
Thanks.